I'm Jason Glaser. I'm the CEO and Executive Director of Isla Network. We're dedicated to protecting workers in a changing climate. And our ENBEL project is called PREP. That's Prevention, Resilience, Efficiency, and Protection. And it's really about protecting workers who face the greatest risks from climate change. Like think of your worst jobs, your sugarcane cutter, your salt pan worker, somebody working in a foundry without proper ventilation, or a gold miner. That's really what we're trying to do. So why are we concerned about workers in a warming climate? It kind of comes down to an idea of heat stress, and you're thinking, oh, it's hot everywhere. I'm fine when I'm in the heat. I go to the beach. It's all fine. But you're relaxing. You're under the shade most likely. If you're not, you're not doing much. You might go for a swim. You might even be surfing. But it's really different if, let's say, you're at that tropical beach vacation and you're on that beach enjoying yourself. Maybe 100 meters back, there's a sugarcane field. And in that field, there's men and women who are cutting 6 to 9 tons a day. They have to wear heavy clothes to protect themselves from the spines that grow on sugarcane and the hard work. And they have to wear their personal protection equipment and the rest. And so they're in that same heat, that 40-degree heat, except their core temperature is going up and up and up, because not only are they in that high temperature, but their core temperature is going up to meet that environmental temperature, even surpass it. And so they can't get rid of the heat into the environment. And that means their core temperature goes up and up and up, and that can have a cascading effect that is almost always completely negative and can really harm the body and has several consequences. So if you think about some of the impacts of heat stress, that core temperature going up and up and up, you might have experienced some of these yourselves on a hot day during a heat wave. I mean, one of the most common is you get disoriented, and that can lead to falls, that can lead to injuries. Let's say you're working with a machete or you're working with heavy equipment, you can have really catastrophic injuries. You can have amputation, you can have cuts, lacerations. And so that's one thing that comes from heat stress. One of the other ones that really affects industry is loss of productivity. You just can't keep up. You're disoriented, you don't feel well, you can be nauseous, and it just kind of hurts too much to keep going. And you can't maintain your rhythm, you can't maintain your focus. And I think a lot of people in Europe have probably experienced that even at work in front of a computer if they don't have AC at their job this summer in particular. So now imagine you're in a sugarcane field trying to stay focused, trying to maintain your coordination in your body, cutting that sugarcane with a machete, and you're paid by piece rate. So you have this perverse incentive to keep going, and it can be really, really dangerous for you. So you have that loss of productivity, but you're trying to overcome that loss of productivity, which can lead to more injuries. One of the really terrible things that can happen are early mortality. You have a heat stroke, you don't get treatment quickly enough, and you're gone. And then that is obviously catastrophic. And then there's cost to that. One of the worst things that can come actually from a consequence of heat stroke if you survive, and also we believe repetitive injury, is to the kidney. So it's hot and hot and hot. An area of the body that gets kind of localized assault is the kidney, and you have repeated kidney damage or one big hit, or maybe a bit of column A and column B. And in the end, very young people in the tropics are ending up with kidney failure. And these are places that can't afford treatment. And that means you're moving people out of a workforce, damaging the local economy. Often these people die very young. I'm talking 20s, 30s, average age of death being 42 in some communities, because they did nothing more than went to work. And then what that happens is you've now affected the local economy because you've taken that prime earner out of the workforce. And then what does that mean? The kid goes and replaces dad or mom in the workforce, or mom and goes into the workforce and replaces dad. Kids have to leave school. So it has all these knock-on effects. And then for the wider society, I mean, a lot of countries can barely afford dialysis in the developed world. So if you're in the global south or the developing world, they can't keep up with the costs. So treatment's either out of reach or catastrophically expensive for the healthcare system. All right, so we've got this catastrophic situation. People are cutting their arms off, they're dying of kidney disease. This is a very bad scene. And that sounds hyperbolic, but in reality, these things happen quite frequently. I'm talking about a prevalence of 68% in some communities of kidney disease of men between the age of 18 and 60. I mean, this is a true pandemic around the equator. And it will get worse with climate change north and south. So we really have to figure out a way to address this. I mean, mechanization is one way, but there's other considerations there about replacement of economies that aren't being kept up with by the development sector. So what do we do? I mean, we have to figure out how to manage this as quickly as possible, as practically as possible, so we can prepare to help the people who are already affected. And what's going to happen north and south as we have heat waves even in southern Europe and northern Argentina that are going to have similar impacts on populations that are not used to these kind of conditions. So we developed a program called PREP, and that stands for Prevention, Resilience, Efficiency, and Protection. And I'll just break that down for you and kind of talk about what we're doing and how we measure it. So the prevention aspect, that first P, is really about the prevention of the health effects of heat stress. So, and it comes down to a very simple idea. Rest and shade that are scheduled to bring that core temperature down and on a schedule that's dictated around the level of workload. So if you work a very heavy job, you have to take more frequent breaks for longer to keep that core temperature down. And that's under shade that is mobile and always close to the work front if it's in a field, or in air conditioning if it's an internal area. And that's really important because you have to protect people and keep that core temperature down, and it has to be viable and it has to be well implemented, and it actually takes on a lot of logistic considerations if you're thinking about like an 80,000 hectare sugar mill with supervisors who maybe have a high school education. So you really have to figure out a way to make it viable, practical, affordable in these kind of low resource settings. So that's kind of the prevention. You're trying to limit heat stress, you're trying to limit those things that cause damage to the body and can cause accidents. The next one is the R, the resilience. So how do we measure that, or what are we really looking at? So in prevention, one of the outcomes we're looking at is like, can we stop the kidney injury? Can we stop kidney disease, other heat-related illnesses, injuries? In resilience, we're looking at the community level. So we get a baseline of socioeconomic data, and we follow people who are receiving the intervention at work and households that have people that are not receiving interventions that work in similar jobs. And we look at what's the benefit over time to communities when people aren't taken out of the workforce from disease, aren't taken out of the workforce from injury, and see what is the difference in their socioeconomic outlook and their hard numbers. Like, are they more resilient to shocks, and are they more resilient to the general kind of low-income situation which they find themselves? And how can we show that having these programs has a knock-on benefit on a community, on a household level? So if you're protected at work, it has benefits at home, and it's better for society. And we're also able to kind of extrapolate costs onto the healthcare system by seeing how we reduce the incidence of disease on the community level. So we're really trying to show you protect workers, they're one of your most important resources on any job. They are your most important resource. That's not a question, they're it. And if you have to protect them, then it should be able to benefit your company and benefit the community. And so then we move into efficiency, the big E, right? This is what companies all get up in arms about any intervention. And what we keep finding is usually if you treat workers well, you find out there's knock-on benefits to efficiency and return on investment. And of course, that's what we found here. Efficiency per hour actually goes up even with the breaks because people aren't exhausted and just pushing through and slogging. They're able to rest, recharge, and go hit it hard. These guys are proud of their jobs. They're defined by their jobs. So they really work hard. And then you get a chance to take a break and rest. You can recharge and go again. And that's very different than being faced with a 12-hour workday without a break, without water, where you're just kind of slogging it out and trying to get through. So what we've seen is they actually cut more cane per hour in the time that they work with the sugarcane sector. So efficiency goes up. And then we've looked at the return on investment, meaning this costs money to do the program. You have water that's got to be potable. You have hydration fluid that's like Gatorade. You have these mobile tents, and you have supervisors to make sure it all gets done correctly. And what we found there is that you actually get a return on investment because you retain people. People get better at their jobs because they're not being removed out of their workforce as quickly, and you have less injuries. You're not paying Social Security for illness and damage to the workforce. And so companies end up doing better, not worse economically. So we've been able to demonstrate that, which is great. We had no idea what we'd see, and we got good news. So we've been able to move forward. And the protection part, that last P for PREP, is really about policy. How do we synthesize all that data about the prevention aspect, the diminishment of damage to the body, the resilience aspect, the improvement of outcomes on the community, the efficiency aspect, the improvement on outcomes for the firm. How do we now translate that data into information that's actually usable to a decision maker, be it in the private sector, be it in the health ministry or the labor ministry in a country, and also to trade deals and everything else. I mean, this is fundamental. You got to protect people at work. You got to minimize these costs to society, these externalities that they used to be, and you got to have people kind of take responsibility for the workforce, but show them a way to do it. And put the responsibility on the employer to make sure that they protect people while they're at work. It's their job. None of this worker blaming stuff. This is about people who employ people having the responsibility to create a safe and productive workplace. And what you find is most workers, when provided with that environment, do great. You know, there's not a lot of workers who are out there harming themselves intentionally. So it's been a really amazing program, and it's had a huge impact, I think, for ENBEL because we've gotten pretty early results. And ENBEL's been enormously positive for us because what we've been able to do is share our findings more broadly. We've been able to share them with COPE and development banks and have people start understanding that this is a real risk. It's going to get worse, but there's a way forward.